Hi, everyone. Welcome to today's webinar. I'm going to give folks a few more minutes to join, and then we'll get things started in a couple minutes. All right, we're going to go ahead and kick things off for today's session on uncovering strategies to better engage with rural patient populations. And what we're really hoping for everyone to get out of today's session is just having a better understanding of different types of strategies and tactics that you and your team can leverage and use to help engage with your patients, especially during the pandemic and with all the changes going on. So we're going to be sharing a few use cases from FQHC customers that we have partnered with. One of those being Tracy Smith from Rural Medical Services. Unfortunately, she was unable to join for today's session, so we're going to be sharing on her behalf, but we'll be sharing a little bit of her story and some of her use cases, and as well as a little bit more about our solution CM Lite, which is our free 60-day COVID-19 messaging platform that you guys could get started with as early as today if there was interest. So yeah, we're really looking forward to today's session. Please ask any questions using the Q&A button that you'll see at the bottom or using the chat. We'll be monitoring both of those. So please ask any questions throughout the presentation and we'll be sure to cover those at the end. And if there's any questions for Tracy in particular, that we're going to share those with her as well. And with that, I will go ahead and pass things off to Christine Chang.
Hi, everyone. Good morning and good afternoon. My name is Christine Chang. I'm the Strategic Partnerships Manager here at CareMessage and very excited to share CM Lite and the stories from Rural Medical Services on their behalf today. A brief introduction to CareMessage and who we are. We are a 501c3 nonprofit organization founded in 2012 as the first and only patient engagement platform designed specifically for safety net organizations and underserved patient populations. To date, we work with over 300 safety net organizations across 40 different states. And since March of 2020, we have sent over 20 million COVID-19 related messages. And this has been done by our partners using both CM Lite and our full platform solution. Today's focus is to address and to support the work that either RHCs, critical access hospitals, or FQHCs and free and charitable clinics serving rural underserved patient populations specifically. And we're proud to work with various organizations serving that community, a few of who are listed at the bottom of this slide. As part of CareMessage's COVID-19 response, in addition to creating the free CM Lite version of our platform, which we'll talk about, we also launched Project Equity, which is a concerted and focused effort by our organization to reach health centers and safety net providers like yours serving communities disproportionately affected by COVID-19. This certainly, of course, includes rural and migrant worker communities, as well as those, as well as Black or African American, Latinx, Native American, Alaska Native communities as well. A brief introduction to CM Lite and the type of communication that we're facilitating through this platform is to specifically support organizations who perhaps didn't have a communication layer in place in response to the pandemic, or perhaps found other methods of communication that they currently had ineffective, or perhaps not flexible enough to respond to the messaging needs that organizations were facing March and onwards and even to this day. And so CM Lite focuses on two types of communication. The first is the ability to send a single message out to hundreds or thousands of patients through our group outreach functionality. The second would be one-to-one patient messaging. So any care coordination, any follow-up that you would do with a patient, you can do through direct messenger. And we've even seen some organizations providing scheduling discussions and being able to reach patients this way, especially as many have thought about how to really bring patients back into the clinic for services that they were perhaps unable to provide during March and April. We'll talk about that example in addition to Rural Medical Services story for another FQHC partner of ours that is also serving rural populations or certain communities in their service area. CareMessage Lite, or CM Lite, is intentionally designed as an unintegrated solution because we wanted to give health centers and safety net providers the ability to begin sending messages within a matter of days or even hours of having access to our platform. We'll walk through this user workflow during the demo portion of today's webinar. And so the way that our partners use this and do this is through our file center to upload patient lists, create groups automatically or cohorts of patients that they want to reach, and the ability to send those messages out. CareMessage as an organization, we care deeply about building phenomenal interoperable technology that's flexible and customizable, but we also care deeply about what it actually means and to address and to support safety net communities and underserved populations. And so in addition to the heavy focus we have on technology, we also have developed a robust content library. This is available to all safety net organizations, regardless if you use CM Lite or if you're using our full platform. Our COVID-19 message library includes over 60 messages offered in English and Spanish, written at a 6th grade reading level or below, and addresses the various use cases and communication messages that our partners have wanted to send since March. This, of course, addresses things like hand hygiene, social distancing, testing availability. We know that for our rural health center partners, perhaps this is discussing and really being intentional about the transition to telemedicine or making sure that your patients know that this is an option. We also know, again, for some of our rural health center partners, that this also includes perhaps letting patients know about extended hours to come into the clinic if needed, if you do have those available right now. And clinic closures, of course, is an incredibly important topic, especially as some of our health center partners are experiencing inclement weather right now. CM Lite is designed and is offered to our users and made possible for free by generous philanthropic support from our donors. So it's free to use for at least 60 days. There's no long-term commitment for a health center to purchase CareMessage, to look at our full platform. We really want to make this as much of a free service as possible to any user and any safety net organization in need of a communication solution during this time. Our public and free COVID-19 library, again, addresses a lot of the topics that we've seen our partners wanting to communicate to their populations about. And so you'll see a few examples that are very recent and very relevant, again, for our discussion today and the focus we have, which is letting patients know that not only is the health center now open or reopened and providing regular services or non-emergency services, being able to communicate and provide the reassurance that it's safe and it's okay to come in, and at the health center, you're taking additional measures to ensure the safety of all patients when they are coming into the clinic. You'll notice in the top right-hand corner example that this particular health center, and these are actual messages that our partners have sent, these are anonymized, of course, that they make mention of their telehealth appointment options. And as part of our message library, we've actually created a YouTube library that's public and free for any provider to use, providing telehealth tutorial videos in English and Spanish, as well as tutorials specifically for Doxy.me and Zoom solutions. We also know that access to social services and access to local community resources is critical not only during COVID-19, but year-round for rural health populations. And so you'll see some examples of local resources and community-based organization partnerships that these health centers have secured and are thus able to provide things like free drive-through for fruit and veggie pickup, or access to housing services and agencies who can support communities and their families right now. We know that during this time, it's important to send relevant messages. It's also important to send messages such that you can collect bidirectional responses from your patients. Our telehealth example here, and this is one that our health center partners have sent, not only communicates to patients that your organization is now offering telehealth appointments, but what communication preference do you prefer? Or perhaps what technology do you have access to? And are you in an environment where you would be comfortable taking a telehealth, whether it's telephonic or video visit virtually with your provider? CareMessage enables health centers, and CM Lite specifically enables our partners to send out these questions via multiple choice, collect those responses, and then automate responses acknowledging that the patient has replied and perhaps offering additional content or resources that's customized to the patient response. So you'll see that the correlating response here in the example actually includes a link to the website or to a video such as the tutorial video that we offer. We'll go very briefly into the user workflow for CM Lite and what this looks like, and then we'll go into the two health center examples on how these organizations are reaching their patients during this time. I've gone ahead and I've logged into CM Lite, and in this example, actually, we're looking at a full platform configuration. This is a demo environment, so none of the patient information here is real. And we'll begin by walking through the user workflow as if we're getting started with CM Lite today. I'll first want to upload my patient population into CareMessage or into the platform. And so I'll do this by way of the file center. We have many of our partners today uploading lists that they are getting out of their EMR or out of their population health management solution. And then upon uploading the patient file into CM Lite, you'll be prompted and asked if you want to create a group. And so you have the ability to create specific cohorts of patients through the file center process, enabling you to be even more efficient in your outreach strategy and scheduling and setting up campaigns. And even if you choose not to create a group, you'll always be able to access and view all of your patients in the Patients tab of CM Lite. Upon uploading all of the patients that you want to reach into our platform, you'll go ahead and have the ability to start scheduling outreach messages. As I toggle over to outreach, you'll see that I have a historical and active review of all the messages that we have ongoing, some that have been completed, some that are active, as you see on the bottom there. And we'll go ahead and we'll just create an outreach, and I'll take you through the workflow that our CM Lite users use today, starting with selecting the patients you want to reach. So in this case, we can, of course, filter and create groups of patients based off of other demographic information we might have uploaded, or we can select a group that we might have created through the file center upload process. Upon selecting the patients that we want to reach, and I won't select any for the purposes of today's demo, we'll then go ahead and select a message that we want to send. You can go ahead and copy and paste a message from the public library that we have. We upload a few of the most common templates that our users send today. And so you'll see the telehealth example that we described in the presentation here loaded. And you'll notice this is where I have that opportunity to customize the message based off of how patients are responding. Perhaps it's my organization is using Doxy. So you'll see that I've actually included a condensed link or a bit.ly link here such that I can provide that resource out to patients who are replying that they prefer telehealth or specifically video messaging or video appointments, excuse me. If I prefer to create and craft all of the messages on my own, I always have that option as well with CareMessage. And you will notice that we do have the ability to not only collect multiple choice responses, but yes, no responses as well. If you're sending out a general message that doesn't require a patient response, perhaps you're letting patients know about clinic closures or other types of messages, you can also make it a no response needed message. Finally, I'll select the date and time that I want to schedule this message to go out, and I'll save and create my outreach upon filling out that last step. Very briefly, we can look at the results of a campaign and look at one that's ongoing. I'll actually click into the flu shot reminder example that we have here, where at a high level, CareMessage offers me the dashboard level view of all the patients we have messaged, who has opted in or perhaps opted out of receiving these messages, and the overall response rate. And then, of course, being able to see the actual content and what we sent out or what we have actively being sent out today. And when I click into the Patients tab, I can, of course, then see the one-to-one communication and what this actually looks like based off of patient responses. You'll notice at the top that in addition to being able to filter by response type, we have the ability to flag messages that may potentially need additional review. So in this case, if I have set up this campaign as a yes/no response, which I have, and a patient replies back with something that we don't recognize, maybe they say, I don't understand what this is, or who is this, CareMessage will automatically flag that response, and I can then review that patient and just see what they had actually said. In those instances, it would make a lot of sense to potentially reach out via direct messenger, also included in CM Lite, and send a one-to-one message providing that clarification that this is your health center reaching out. Or direct messenger can be used for any type of one-to-one patient communication, including care coordination, connection to local resources, based off of patients perhaps self-identifying via outreach messaging that they do want to receive additional information around housing support or access to food or transportation, which we know is really important here. We know that in the rural healthcare setting that primary care providers do so much more and often have to act as an unofficial specialist for their patient population and be incredibly knowledgeable on other types of services. And so that's where we see direct messenger also being incredibly powerful for any one-to-one provider communication with a patient. But want to really reiterate that messenger can be used by anyone in the health center organization for any type of one-to-one patient communication. I'll go back into my presentation as I'd love to share a little bit on behalf of Rural Medical Services and from Tracy Smith, who unfortunately wasn't able to join today's call, though she had planned to be. So just as a friendly reminder, if you all do have some specific follow-up questions for Tracy, please feel free to drop them in the chat and we'll make sure that she is able to address them. And please do let us know your contact information so we can make sure we get that response back to you. Rural Medical Services is an FQHC based in Newport, Tennessee. They use NextGen for their EMR and I2Y for their population health management solution and work with about 9,500 patients annually. In their use of CareMessage, or perhaps even prior to using CareMessage, they were only making calls and reaching patients via telephone and had a very difficult time reaching patients. They were spending a lot of time making calls. And I'm sure as many of you can identify with, just found it to be really limiting in the type of communication that they could even have. With CareMessage, they've been able to increase their focus on population outreach specifically. And so as a result, have done outreach to let patients know about upcoming screenings that they are due for, being able to reach out to patients right now, of course, in response to COVID-19, and being able to reach anyone that they've seen in the past 2 years to provide additional resources that their organization has invested in, such as updating their website, providing education and helpful information about COVID-19 on their site, and getting those links out would otherwise have been impossible without a solution like CareMessage or CM Lite to be able to send that message out within a matter of minutes. They plan to double down on focusing on the educational piece and component of their messages by sending informative messages to families to ensure that children are coming in for their annual visit, and then again, being able to take that additional step of bridging their technology offering by letting patients know that they can self-schedule their appointments online. Through the use of CareMessage, Rural Medical Services has really found that wanted to share a few best practices that they learned in their use of CareMessage, which was their advice to you all is to keep your messages short, keep them concise and informative. Remember that patients have access to different types of technologies, including just different mobile device types, and that may influence the way you and the length of messages specifically, just to keep that in mind that not everyone may have a smartphone, though with CareMessage and CM Lite, we do support up to 320 characters with our messaging. And they found specifically for their patient population that sending messages in the afternoon resulted in higher engagement and responses, and that they were able to strategically manage the communication and patient responses by using a combination of no response messages, again, for just those kind of informational messages, ones that are more broadcast, and then yes/no responses when seeking a patient's response. In Tracy's absence today, we just wanted to share another example of an organization that we work with today, Regenesis Healthcare, based in South Carolina. This organization, a portion and a percentage of their patient population is in a rural area. They serve about 13,500 patients annually using eClinicalWorks and Azar for their population health management solution. And wanted to touch briefly upon some of the considerations that this organization had when thinking about how they really wanted to drive engagement during a time when, again, they were trying to identify what combination of messages would make the most sense to ultimately let patients know that they should be coming in for important screenings. And so you'll see the example here of how they uniquely use multiple choice responses to let patients know you should be coming in for your yearly mammogram. They have a mobile unit available, and to actually ask patients, how would you prefer for us to communicate and contact you to schedule this appointment? Should we call you? Should we text you? Or do you not want to come in at all? And based off of the responses received, Regenesis, using CM Lite, was then able to follow up with patients one-to-one with direct messenger to schedule those appointments, or more strategically make outbound calls because they knew that those patients were expecting them. As a result of this effort, they had and saw 210 women schedule a cervical cancer screening. They began using CareMessage or CM Lite specifically in April of 2020. And so they saw an 8% overall improvement for their cervical cancer screening rate in 2 months. I want to conclude the presentation by sharing some of the resources that we've talked about today, how folks can get started with CM Lite specifically by going to our website and signing up for CM Lite, as well as the resources to the message library and the telehealth videos. All of this will be sent out via email follow-up, including the recording of this webinar and the deck as well. And of course, if you have any questions, and I see a few coming through the chat, we'll address those now. Looks like we've actually addressed a Phil's question.
Hey, Christine, we have one question. I'm just going to read it aloud to you. It's from Kathleen Lutton, and she was asking, when sending out individualized messages, can you identify the person sending the message so the patient knows who exactly is contacting them?
Absolutely. And we do recommend that when you are sending a direct message, or perhaps using CM Lite for the first time, that the health center send a note that says, this is Rural Medical Services. We'll be sending you information about COVID-19. And with direct messenger specifically, we definitely recommend that if perhaps you're reaching a specific patient and you are, say, their provider or their care coordinator, that you self-identify. Upon sending that direct message to a patient, you can even tell the patient that they can save that number, and should they ever have any questions, they can actually text back into the health center, and want to be clear that that functionality specifically is available to the direct messenger feature, and patients can only text back in once they've actually heard from the health center for the first time via direct messenger, but thereafter can use that number anytime in the future. We'll give folks about another minute or so to submit any questions that you might have. All right, we will go ahead and wrap up today's webinar. Thank you again, everyone, for making the time out of your busy days to join us for today's presentation. We hope you found it informative and helpful in designing your patient engagement strategy during this time. And as a last reminder, we will be sending out the recording of today's webinar, the presentation deck, the links to these resources and follow-up. Wishing you all a wonderful Wednesday, and thanks so much.